Good evening and welcome to First Aid Chats by Dr. G. I'm Dr. Adana Grandison, a physician in Barbados and your hostess for this evening. First Aid Chats by Dr. G is a live podcast that provides listeners with the opportunity to not only hear complicated medical conditions explained, but also clarify any misunderstandings you may have about that condition. After all, a medically aware and educated patient is an empowered patient. And this evening, our title is Sight Under Pressure. And our guest is none other than Dr. Don Grossner. Dr. Don Grossner is a graduate of the University of the West Indies Faculty of Medical Sciences class of 2000. Thereafter, she went on to specialize in ophthalmology in England for several years and later specifically focus on the specialty area of glaucoma. She did her glaucoma training at Moorfield Eye Hospital in London with an emphasis on surgical management of complex glaucomas. She returned to Barbados in 2010 to establish the Specialist Glaucoma Surgical Service in the Department of Ophthalmology at the Queen Elizabeth Hospital. In 2018, she introduced the newest surgical technique for glaucoma to the Queen Elizabeth Hospital, minimally invasive glaucoma surgery, which has revolutionized glaucoma care with its introduction worldwide. This newer surgical technique provides suitable patients with a simpler and faster glaucoma surgery, which can be combined with cataract surgery. She comes from a family of teachers, and perhaps this influenced her interest in teaching and academia, which has been present throughout her career. Along with her work in glaucoma at the Queen Elizabeth Hospital, she is the University of the West Indies lecturer in ophthalmology. In this capacity, she coordinates the University of the West Indies postgraduate training program for doctors in ophthalmology, a vital service as more doctors are needed to meet the demand of ophthalmologists locally. Dr. Grossner has a passion for education and lectures widely on glaucoma, both to health professionals and general audiences. Her latest venture is to spearhead the formation of the Barbados Glaucoma Society to provide support and information to patients and persons with a vested interest in glaucoma. I also wanted to let you guys this evening know specifically about World Glaucoma Week. Glaucoma, as we know it, it is approximately the third most common cause of blindness, irreversible damage to the optic nerve of the eye, at the point where it leaves the eye to carry visual information to the brain. This damage is manifested as a subtle damage to the peripheral field of vision, but it continues untreated. Glaucoma results in gradually worsening vision damage and possible blindness. Glaucoma usually gives no warning until it's advanced. And this evening, I wanted to introduce Dr. Don Grossner as she presents to us for the international theme for World Glaucoma Week. The world is bright, save your sight. And for our podcast this evening, Sight Under Pressure. Good evening, Dr. Grossner. I'm going to ask Dr. Grossner at this point in time to just call us in. Good evening, Dr. Grossner. How are you doing?
Hi, I'm fine, thank you. Good evening, Dr. Grandison, and good evening, everyone. Thanks so much for the invitation to join you and get the word out about glaucoma.
Yes. So, Dr. Grossner, I've sort of given a definition, but tell us from an ophthalmologist standpoint, really, what is glaucoma?
Yes, that was a very comprehensive introduction you gave for that definition. Really, glaucoma is fundamentally a disease of the nerve of the eye, the optic nerve. And we have only one nerve in each eye. That nerve is what is responsible for how we see and our ability to see. It connects the eyeball to the brain, it sends the signals between the two, and helps us to interpret what we're seeing. So anything that affects that nerve affects the sight. Glaucoma is it gradually causes deterioration of the nerve if it is left untreated, and usually that happens under the influence of a high eye pressure. Now we all have a certain level of pressure in the eye. The eye is like a ball. It's like the eyeball is filled with fluid, and that fluid normally accumulates and drains away in a very normal, natural cycle within the eyeball. If the drainage system does not work well, then that fluid tends to back up. You get the high pressure in the eye, and then that pressure over time impacts on the nerve slowly over many years, and that can cause damage to the vision. And this is why I say if it is left untreated, then of course that would completely damage the nerve and persons can lose their vision and end up with irreversible blindness. But the good thing about glaucoma is that we can stabilize the vision by treating the eye pressure, lowering it, and stabilizing glaucoma.
Hmm. So, what are some of the symptoms that one can experience with these increasing eye pressures? Does it hurt?
It does not, for the most part. It is a very sneaky disease. In fact, it's called the sneak thief of sight or the silent thief of sight because it doesn't cause any symptoms early on, only very late when persons start to notice the loss of vision. And that happens because when glaucoma starts to damage the nerve, it affects the peripheral vision, which is the vision we're using out to the side, kind of what we call when you look out, see something out of the corner of your eye. Now, it's not
Mm.
very often in your day to day life that you use that vision. Most of us are using our vision just looking straight ahead. So, if the damage is starting as it does with glaucoma far out to the peripheral vision, it is only when all of that vision has been lost and it is starting to then encroach or invade the central vision that we're using that persons notice a problem. By the time that happens, so much of the vision has been lost that we're in a much more difficult position to try to save the sight. And the ironic thing is that you can't feel it. You can't feel generally when your pressure is high. The
Hmm.
normal eye pressure is between 10 and 21. And if your eye pressure is above 21, you can't tell unless you have your eyes checked. It is only very rare, the rarer forms of glaucoma where the pressure goes extremely high, that persons might feel pain or discomfort, but that is not the norm.
Okay. Are there any persons in particular that are at risk for developing glaucoma?
Yes, we actually have a pretty high risk here in Barbados. And that's why, over the last 12 years, we've really been pushing this message to make people aware of the importance of early detection because glaucoma is actually the number one cause of irreversible blindness in Barbados. And worldwide, it's the number one cause of irreversible blindness worldwide. Um, the risk factors include if you have persons with your family in it, so a family with your persons in your family with glaucoma, so a positive family history, meaning if you have a parent or sibling, brother or sister, or a child with glaucoma, your risk is higher. And if you look at the World Glaucoma Week website, they indicate that studies have shown that their risk can be 10 times higher than somebody without glaucoma. Race plays a part. Persons of African descent, particularly West African descent, which is much of the population in the diaspora in the Caribbean, North America, UK, and Europe, are at greater risk than other races, and increasing age. So as you get older, that risk is higher. And we have an aging population. We are a majority African descent population, and we're a small country with lots of different families intermingling. So it's like we have the perfect storm for glaucoma here in Barbados.
Hmm. Dr. Grossner, you started off to tell us that glaucoma is the number one cause of irreversible blindness here on the island. Is there any more data that you can give us in terms of what is happening locally here in terms of glaucoma?
Hmm. In terms of the numbers, we know a lot about the situation with eye disease in Barbados and glaucoma in Barbados because of the Barbados Eye Studies led by the University of the West Indies back in the 1980s and 90s. They produced a plethora of information. And
Hmm.
all of those statistics hold true today. So if we look at the numbers, the studies looked at persons over the age of 40. And that is the population more affected by glaucoma. And we found that 7% of the entire population was affected by glaucoma, open angle glaucoma, which is the most common form of glaucoma, the kind that really is painless and symptomless until very late. And as you increase in age, so over the age of 50, then 1 in 11 persons they found was affected by glaucoma. That's almost 10% of the over 50s. And
Yeah.
then if you look at the over 70 population, 1 in 6 persons. And now we have a better idea of the number of people in each age category because, the vaccination campaign has shown us how many thousands of people we have over the age of 70. So if you think of 1 in 6 of those persons and 1 in 11 of the other group of persons, we're talking thousands of people in
Yeah.
Barbados with glaucoma.
So there's really the possibility that you may know either a friend or a relative, or it may even be yourself in terms of how frequent this disease process here is on the island. I also wanted to ask, can stress play a role in causing glaucoma?
You're absolutely right when you say that everybody, and I often say this, everybody is affected by this issue of glaucoma in some way. In a small country like Barbados with such a high prevalence, um, either you will have it or you will have a friend, a co-worker, or a family member who has it. So it's an issue that's of importance for all of us.
Right.
And as time goes on and we all get older, then our risk for it increases. Is something we have to keep checking for. Um, Stress is something that I think affects all parts of the body. And while we don't have hard scientific evidence to say, okay, the stress affects glaucoma in this way, I can certainly share from my experience of patients that some persons do get a stress response in their eye pressure. It's not very common, but it can happen. And we can't quite explain that by looking at the pathways that are affected that we know lead to changes in the eye pressure. But it is common sense because we know that stress is hard on the body. The eyes are part of the body. So you would expect that things that affect your body in general negatively can affect your eyes as well negatively. Often it's a retrospective um, assessment that conclusion that I come to when I see some patients. Sometimes persons retire and I don't realize they've retired, but when I see them in the office and I check this pressure that was giving trouble before, all of a sudden it's better. And when I ask, well, what have you done differently? What has changed? And they say, well, I retired, I don't have the stress of work, so maybe that's part of it, and maybe it is part of it.
Uh-huh. I also wanted to find out, are are there any other risk factors like is smoking? What about drinking alcohol? Can those actually affect the or increase my chances of um, getting glaucoma?
Mm-hmm.
Also, increase use of caffeine because quite often we tend to find persons using coffee, especially to get us through the day.
Mm-hmm.
Or, is that important?
I mean, I don't think I don't caffeine in particular. We haven't found that increases the risk of glaucoma or the severity of glaucoma. Certainly not in moderate amounts. Like anything else, I can imagine to the excess that would not be good for you in general. And
Mm.
we know that excessive use of caffeine might have other effects on the body. In terms of smoking and alcohol, we have to think about the factors that affect the eye pressure, right?
Mm.
And there's no specific pathway to show how smoking and alcohol can affect the eye pressure, but we have a well documented entity in which persons who smoke excessively or drink alcohol excessively can get damage to their nerve separate and apart from the eye pressure. That is called toxic amblyopia. And if we think about glaucoma as fundamentally a disease of the nerve, you don't want to do anything that is going to compromise the function of your nerve.
Right.
The eye is still part of the body. It is nourished by blood vessels, which, like everything else in the eye, are very tiny. And anything that affects those blood vessels and that blood supply could negatively affect your nerve. So the effect of things like hypertension and diabetes on the blood vessels could affect the eye, even though and we know that in our population, hypertension itself is not a risk factor for primary open-angle glaucoma, even though we know in our population, diabetes itself is not a risk factor for primary open-angle glaucoma, although it can cause a different, more complicated kind of glaucoma. Those things still affect the blood supply of the eye and can still cause harm to the eye.
Right. Now, with the use of medicinal marijuana coming onto our market in very short stead,
Mhm.
is marijuana associated with causing or increasing our risk of getting glaucoma, or can it be used to treat glaucoma?
Okay, I was gonna say when you were asking that question at the beginning, you were asking it the other way around because normally I get the other question, the end of your question. Can we use cannabis? Can we use marijuana to treat glaucoma? Because it's one of those things that's been out there for a long time, right? That this can be one of the indications for glaucoma. And even sometimes I think when you go on to websites for overseas practitioners, in places where cannabis has been legalized, you see glaucoma sometimes on the list of things. And unfortunately, I always have to come and burst that bubble for people. Now,
Right.
the part of the reason that idea has been out there is because early research showed that the cannabinoids, one of the groups of substances in marijuana, can lower the eye pressure. The problem is that they only lower it for 2 or 3 hours at a time. And glaucoma is a 24-hour a day, 7 days a week, every single day. It's a chronic disease. So if you were going to use cannabis for glaucoma, you would have to be using it on a continuous basis, 24 hours every single day. And then you would start to get some of the deleterious effects from the other chemicals that are in cannabis. And we know that there are hundreds of chemicals in cannabis. Um, the official, and I always say people don't have to just take my word for it. You can look at the official word, the official output from the international agencies in those areas where cannabis has already been legalized ahead of us in the Caribbean. The American Academy of Ophthalmology, the Royal College of Ophthalmologists in the UK, the Canadian Board of Ophthalmology, all of these entities have said that at this time, cannabis cannot be recommended as a treatment for glaucoma.
Mm-hmm.
Um, and then, from I joined that scientific side of things with the experience, right? Because,
Right.
in medicine, we have the evidence and we try to be evidence based and we use the articles and the science, etc. And then we have an arm of it that we apply to what we do and what we see in practice. And we are looking to see if that is borne out in what we see, right? If it all matches up. And definitely I can say I do have a few patients, or I have had a few patients who were heavy marijuana users, and those always stand out in my mind because those are the youngest people that I've had to certify as blind, to register as blind because of glaucoma.
Well,
And for me, that's a very strong statement.
absolutely. Absolutely. You spoke about different types of glaucoma, with open angle glaucoma being the most common form of glaucoma. Can you really break down really what is open angle glaucoma versus, for instance, the more painful angle closure glaucoma or closed angle glaucoma?
Yeah, sure. So we said that glaucoma is a disease that affects the nerve and often is associated with high eye pressure. And the reason for the high eye pressure is related to the drainage system. So we all have this fluid inside the eye, like we said, it's constantly being produced to nourish the tissues inside the eye. And that fluid is supposed to drain away down the drainage system inside the eyeball. That drainage system, tends to get affected in glaucoma and doesn't work, but it can get affected in different ways. And the different ways it gets affected relate to the different, it basically gives us an idea of how we categorize the different types of glaucoma. So you can think of the drainage system like a sink, your kitchen
Right.
sink, your bathroom sink, where the tap is always on, producing this fluid flowing into the sink, and the drain is always open to allow that fluid to go out. That's like how the circulation of the fluid works inside the eye. Tap is always on to produce that fluid, and then that fluid goes out of the eye down the drain. In open angle glaucoma, it is like when you can look at the hole in your sink and see it's open, but you can sometimes the blockage is a little further on, so the fluid is still backing up. You can see fluid backing up in your sink. You know this drain isn't working properly, but you can't see any blockage. That's what open angle glaucoma is. The system looks open, but it's just not working like it should. And that is the most common kind. And that's the painless loss of vision that people get. You don't get any symptoms at all. On the other hand, if you put a plug or you put something in your sink physically to block that hole, you can see there's a blockage there, and you can see why that fluid is backing up. That's what happens in angle closure glaucoma. We call the drainage system of the eye the angle. So when that angle is closed or that drain is closed, the fluid backs up. And of course, if you put the plug in, that fluid can back up very quickly. And so the pressure can rise very quickly and to an extremely high level. If you leave the pipe on, you plug your sink, it's going to overflow. The eye can't overflow because it's a closed system. Your pressure is not going to get high enough. You can't burst your eye. But what it does then, it will give you severe pain. And if persons develop that kind of glaucoma, they get sudden severe pain, and that will often bring them to the emergency room because it's so severe, affects the vision so suddenly. It can make people feel quite sick, quite ill. That is very rare. I mean, thankfully, that is very rare in our population. There are places overseas where it's more common, but for us, that sudden, painful kind is very rare. And those are the two main categories of glaucoma. I usually add on two other categories, which is the pediatric glaucoma,
Right.
glaucoma in children, which is completely different from adults, and then secondary glaucoma, which can happen to your eyes if you had another problem. So if you got hit in the eye, you could develop glaucoma as a result of that later on. Or if you develop severe diabetic eye disease, you could develop a problem, glaucoma, as a result of that later on. So four main categories.
Okay. Does increased pressure in the eye always result in glaucoma? Does it automatically mean that I have glaucoma if I have increased pressure in my eye?
No, and that's a really good question. A really good comment as well. The often it can precede glaucoma, and it can be a warning to us. We only say somebody has glaucoma if we see not just the high pressure, but the actual damage to the nerve. And if we imagine that fluid inside the eye and that pressure impacting the nerve over time, it starts with the high pressure, but then you can see the damage to the nerve and then that damage to the peripheral vision. That is almost like a sequence of events. So some people, particularly when we're doing the early detection and we're screening, we can pick up if somebody has a high pressure even before they develop glaucoma. And if we pick that up, then we have a discussion about treating that and preventing glaucoma later on. That is called ocular hypertension, like high pressure in the eye,
Right.
ocular hypertension. And there was actually a big international study done many years ago to look at what are the chances if you had ocular hypertension that you could develop glaucoma later on, because we discovered that high eye pressure is the number one risk factor for glaucoma.
Mm-hmm.
So we said race, we said increasing age, family history, but eye pressure eclipses all of that. So
Right.
if your eye pressure is high, then your risk for developing glaucoma is actually much higher.
And that is, if you want to catch a person, that's where you would prefer to catch them, when they just have ocular hypertension and not glaucoma, where you can
Mm-hmm.
actually intervene and really assist them and prevent them from getting glaucoma.
Yeah, and it's important to know that we don't know everything about glaucoma. We don't
Right.
know why, one day you're going on fine, you're 50, you're good. And then at 51, your pressure goes up and then you start to develop glaucoma. We don't know why that happens. And
Right.
we also found that there is you know, for persons who have a high eye pressure, uh, if you treat people, you can decrease their risk of glaucoma by half, but you can't
Right.
eliminate that risk completely. But a decrease by 50% is enormous,
Significant.
um, significant. So for sure, if we can catch people at that point in time, definitely that's the time we want to intervene.
Is there a correlation? I'm seeing a question here. Is there a correlation to glaucoma and diet, or are there any lifestyle issues that can impact this disease?
Mm-hmm. Um, we I like this question because, when you have a chronic disease and we, the physicians, are saying, well, the way to treat it is, you have to take eye drops, so you have to take this medication, and it's a lifelong thing, or you have this laser treatment, or you have this surgery. Patients often want to know, what can I do? What can I do naturally to help myself? Is there any special diet that I can eat to lower this eye pressure? Uh, Exercise, all those things, all those modification factors people are curious about. And while there's no specific diet that's going to lower your eye pressure, I always go back to the fact that the eyes are part of the body. So the same sensible, balanced, healthy diet, low salt, low sugar diet that we do to stay healthy is would be good for your eyes.
Right.
Diet high in antioxidants is very good. So the green leafy vegetables, spinach, kale, that sort of thing, those are very good. You always hear about carrots being good for the eyes. Of course, carrots are good for the eyes. All those things are important for your eye health, even though specifically they won't have an effect on your eye pressure or glaucoma. You still want your eye to be in the best condition possible. Exercise, on the other hand, we have a lot more evidence for. There have been many studies to show that aerobic exercise actually helps to lower the eye pressure. And the data shows that uh, aerobic exercise at least 3 times a week will help to keep the eye pressure under better control. So I encourage people. Again, it's a common sense thing, right? Exercise. What is exercise not good for? Exercise is good for your body, for your hypertension, your diabetes, and it's good for your glaucoma as well.
Good. And when you say aerobic exercise, just so that we are absolutely clear, you're talking about your running,
Mm-hmm.
any swimming, even probably sometimes a bit of Pilates, a HIIT workout, just making sure that you're getting a good cardiovascular workout. Absolutely.
Cycling, anything like that.
Cycling.
Exactly.
Great.
Things that
Excellent.
you're doing to get your heart rate going.
Excellent. Good. We have another question here. Is glaucoma something that is normally screened for when you go to an ophthalmologist, or is it something that you have to specifically request?
When you get your eyes examined by an ophthalmologist, so a doctor that is trained in eye care like myself, then yes, that's a routine part of our examination. But sometimes persons will have their eyes checked by an optometrist,
Right.
which are the persons that in our minds we associate with giving spectacles, glasses, contact lenses. They can also check your eyes for glaucoma. Sometimes people will call them the optician, but the
Right.
new word, the modern word is optometrist because this group of primary eye care providers, they do more than just spectacles and contact lenses. They also check the health of the eye. Now, if you go to get your glasses checked, you have I can't. I'm not sure. I can't say 100% that if you get your glasses checked, your eye care your optometrist will do a check for glaucoma. I imagine that most of them would, but I encourage persons to ask a question. Right?
Right.
If you go to get your glasses or contact lenses done, then not just ask, "Oh, did you check for glaucoma, or is there any sign of glaucoma, or could you do a check for glaucoma?" Because if you go to someone for a specific targeted treatment, I can't be sure, if they would do the rest as well. And how would you know that you've had a check for glaucoma? Part of the glaucoma test is having your eye pressure checked. So if you go to the optometrist, often they would do that with a puff of air, which is the tonometer, the machine to check the eye pressure. If you go to the ophthalmologist, which is the eye doctor, we would do it with eye drops and a blue light shining in the eye. Sometimes we have portable machines. Now, both of us, the optometrist and the ophthalmologist, sometimes we will check with portable machines that make a beeping noise. In order for us to check the nerve in the eye, we will shine a light in the eye to check the nerve, which is at the back of the eyeball. So, this is how you would know you've had a little bit extra done beyond just getting glasses or contact lenses.
Right.
For sure, if you go to the ophthalmologist, that's a routine part of the examination.
Okay. Can someone who does not have increased eye pressures still develop glaucoma?
Hmm. So that's the other side of the coin, right? We talked a lot about ocular hypertension and having high pressure and that leading to glaucoma. But it goes back to to what I said about us not knowing everything about glaucoma. There is a category of persons who can develop this damage to the nerve even at normal or low eye
Hmm.
pressures 21 and under. And in those persons, we think that it is related to the fact that for some reason, often unknown reasons, the nerve is just susceptible. So
Right.
at lower pressures, so it still gets damaged. And in those cases, we look for other things that could be affecting the nerve. We look at those blood supply issues I talked about. Is the person getting very low blood pressures and the blood supply is not getting to their eye? Do they have other factors like obstructive sleep apnea, which we've discovered is a risk factor for glaucoma and progressive glaucoma? Because with obstructive sleep apnea, which is where you don't breathe or you stop breathing intermittently when you're asleep, that can deprive your nerve of oxygen intermittently, and that's an issue. Um, or we think of any other things that could be compromising the blood supply to the nerve. So that can happen. That's called normal tension glaucoma, where persons can develop glaucoma at lower eye pressures. Also, not very common, but this is part of the whole gamut of the field of glaucoma. And this is why persons will often hear me say too that it's a very individual disease. You
Right.
know, for each person, you have to take that history and do an examination to really tease out what their individual risk factors are, what their individual risk or likelihood of glaucoma is. And if they do have glaucoma, what level is it at? Is it at a mild level? Is it moderate? Is it more advanced? And what we need to do will depend on the kind of glaucoma you have and the level of mildness or severity.
And that's why it's important that you do a combination of two things, not just check the pressures in the eye, but also actually really look at the nerve itself to really make that determination to see if there's any damage.
Absolutely. Absolutely. We can't ever forget that fundamentally it's about the nerve. The nerve is the center of attention when it comes to glaucoma.
Right. We have another question here from one of our listeners. Can lack of sleep cause glaucoma?
Not as far as I have encountered. I will say that chronic insomnia, I mean, and Adana, you are the general practitioner here, you're the family physician. Insomnia is something that really can affect the whole body, but
Yes.
we haven't specifically seen that as a cause of glaucoma.
Right. But certainly an increased association with increased stress and an increased inflammatory response and stuff like that. So overall health, it can cause an impact as such.
Exactly. And we really have to remember again, the eyes are these two delicate structures that are part of this giant body that we have. And this body is a finely tuned machine, and we have to try to keep it in optimal condition, do everything we can.
Absolutely. Absolutely. So you spoke about that nice comprehensive examination that you do and the history taking, which is so important. I often tell students it's so important to take a history, a comprehensive history, so that you really understand what you're dealing with, and so that when you go on to examine your patient, you know what you're looking for. You're examining with a purpose. But what can we do after we have been examined as the patient and we've been given that diagnosis of glaucoma? What are our options?
First, don't panic,
Hmm.
because, when people, we talk a lot about glaucoma being a blinding disease and irreversible blindness. So sometimes when persons hear they have glaucoma, they think, oh my goodness, I'm going to go blind. Eventually that's what's going to happen to me. And that is not the case at all. With so many options that we have for treatment, we can really save persons' vision. The aim for us in treating glaucoma is to get that pressure down to a level where we can stabilize that damage, stop it from progressing, stop it from getting worse. Yes, we know that at the time we make the diagnosis, if you have damage there, we can't reverse that. We can't turn back time. But at least we can try to hold you where you are and maintain your vision for your whole lifetime. This is why getting diagnosed, if you're going to get this problem, picking it up early is so important, because if we can pick it up early when there's very minimal damage, then we can preserve person's vision for their entire lifetime much more easily. The options for treatment, traditionally, the first line thing we would use are eye drops.
Right,
And first line eye drop is just one drop at night. It works for 24 hours, so it's something you would have to use every day or every night, of course, just once. So not a huge medication burden, and
right,
that persons would have to use consistently, and then come back in a few weeks' time to see if it's working. But now we also have the option of laser treatment that we can offer to persons, and this is part of the advances over time, because a lot of research has gone into glaucoma therapy over the years. And for a long time, there was a drought. There wasn't a lot of excitement in what was happening in glaucoma treatment. And then suddenly, in the last 5 to 10 years, we had a huge improvements and huge explosion in advances in glaucoma. And laser treatment and the effectiveness of it for glaucoma is one of those things. The laser treatment is not the kind that makes your vision better and gets you out of your glasses. Different kind of laser treatment that's specifically targeted to the drainage system of the eye that can help your natural drainage system to work better and therefore lower your eye pressure. The unfortunate thing is it doesn't work for everyone. It's not as effective as eye drops in terms of the percentage of people that we will have success for. So if I put someone on an eye drop, I know 99.99% of the time that eye pressure is coming down where we want it to be. With the laser treatment, only 75% of persons will have that success. But if you're in the 75%, it means that you don't have to have eye drops, or you can delay the time that you can start your eye drops. The
Right.
laser treatment usually lasts a maximum of 5 years. It's something that's repeatable. So if you're a young person in particular, we're seeing younger people in their 30s, sometimes in their 20s with glaucoma. Young, you're looking at potentially a lifetime of eye drops. Anything you can do to delay that is usually very appealing to younger
Absolutely.
people.
Absolutely. And use in my introduction for you, we heard about the combination of glaucoma surgery and cataract surgery. Tell us a bit about that.
Yeah, so we have said that persons with glaucoma tend to be maybe the older age group, and that also tends to be the age group where people are starting to develop cataract as well. And often people wonder, well, if I have glaucoma, can I get cataract surgery? Is it safe to do cataract surgery? And it absolutely is. In fact, in many cases, just having cataract surgery can be helpful for your eye pressure. It can actually help to open your drainage system. In those people that have the narrow drainage system, the narrow angles, removing the cataract, particularly at an early stage, can really help to open up that drainage system and give more space for that within the eye. So I often will see persons with cataract and glaucoma hand in hand. We can also combine the two. So you can imagine if you are 70 and you have glaucoma that requires surgery and you have a cataract as well, why would we put you through one surgery and then go back and do a second one when we can do the two together? And that is where minimally invasive surgery has been really revolutionary
Right.
because the traditional kinds of glaucoma surgery tend not to work as well with cataract. But the new minimally invasive glaucoma surgeries, which are shorter to do, faster, they are technically more demanding for us as surgeons. They, all kinds of fancy stents and gadgets that we use. Because for the minimally invasive surgeries, we are going into your natural drainage system and expanding it, helping your drainage system to work better. That's technically more challenging for us, but for the patient, the experience is a lot more pleasant. And we can combine that very easily with cataract surgery. And we're finding that together there's a synergy. If you do minimally invasive surgery and cataract surgery, you get a better decrease in the eye pressure than if you did the minimally invasive surgery alone.
Right. Okay, great. Can spending too much time looking at a computer screen, I know we're in the middle of COVID and doing everything via Zoom and Microsoft Teams and all the other different electronic platforms to help us with work or school. Can spending a lot of time behind the computer screen increase your risk of glaucoma?
Thankfully not, Adana, because if that was the case right now, for the last year, I would be in deep, deep, deep trouble. And all the
Right.
ophthalmologists would be inundated if you think of how much time we've all had to spend on our screens. No, I think
Absolutely.
working on the screens can cause dry eye in some people who are susceptible because anything you're doing on a prolonged basis, even reading on a prolonged basis, watching television, anything you're doing on a prolonged basis allows the tears of your eye to evaporate more. And usually, if you're concentrating on something, you're not, we don't realize it, but you're not blinking as much. And
Hmm.
blinking is what helps to distribute the moisture across the eye. So, problems with dry eye are more what we're seeing as a result of increased use of screens and so on,
Okay.
but not glaucoma, thankfully. We have enough of a problem with glaucoma
With
in the world
glaucoma
right
as it stands.
now.
Yeah. I have another question here. Is there any occasion where extremely low pressures affect the optic nerve?
Hmm. Thankfully, that's very rare to have a low eye pressure. And if you are I say the average person, all of us walking around normally, something has to happen to your eye to make your pressure go abnormally low. It's not going to just, one day you wake up and your eye pressure is low and you're in trouble. Um, Usually we see that if persons have chronic problems in the eye, like sometimes chronic inflammation, if you've had an eye injury, a severe eye injury, and sometimes if you have glaucoma surgery that's working too well, very rarely that can make your pressure go low.
Mm-hmm.
Now, the range of normal pressure is between 10 and 21 millimeters of mercury. If you have surgery, if you have good surgery, your pressure can go down to single digits, like 9 or 8, which is fine. We don't worry about that. But we still have to remember the eye is a ball that's supposed to be filled with fluid. So we don't want your pressure to go down to 1 because that would suggest you don't have enough fluid inside the eye to maintain the structures the way they're supposed to.
Right.
And that is the sort of level, a level when your pressure is below 5, that is a sort of level where you can start to get the low eye pressure affecting the structures at the back of the eye, including the nerve to a small degree, but not in the same way as glaucoma. It doesn't
Mm.
affect the nerve in the same way as glaucoma. It actually affects other structures like the retina at the back of the eye more so. So this is part of the reason why glaucoma surgery is a very specialized area.
Mm-hmm.
Most of us acquire the skills for cataract surgery very quickly when we're training. But glaucoma surgery then is something that requires a little extra training to be able to balance, to make those decisions about which patients are appropriate for surgery, then deciding which surgery each individual person would have, and then in executing that operation to make sure that we don't expose patients to that low risk. It is very to that low pressure risk,
Right.
which is very rare.
Right. Are persons with autoimmune diseases with inflammation in the eye more prone to developing glaucoma? That's another question we had from our message board.
Mm-hmm. We're getting some really deep questions this evening.
Mm-hmm. Yeah.
Yeah, that's a concern for some autoimmune diseases. So, not all autoimmune diseases would cause inflammation in the eye. But if you do have inflammation in the eye, which is called uveitis, that can lead to high pressure for some persons. And that high pressure then could then lead to glaucoma. It is not a very common scenario that we see, but that would go into that fourth category of glaucoma that I called secondary glaucomas, where
Right.
something else has happened to your eye and then led to the glaucoma. In this case, the something else that has happened would be the inflammation. Now, people get inflammation in the eye with an autoimmune disease, or you can just get inflammation in the eye out of the blue. Sometimes you get hit in the eye, and one the resulting things is you get inflammation for a time. Just because you have inflammation doesn't mean that your pressure will go up, doesn't mean that
Right.
you'll get glaucoma, but it's the persons that get recurrent bouts of inflammation, often over many months, many years, where you start to see the damage to the drainage system accumulating as a result, and then glaucoma. And that is why persons with autoimmune disease who have inflammation in the eye as a result would be more in that category because, of course, they have an underlying disorder that is triggering the inflammation in the eye. But we have to remember that not everybody with an autoimmune disease will get eye inflammation.
Right. Right. I wanted to ask you specifically because we are in uncharted territory, COVID time. And I know that we've seen in the news that ENT specialists and ophthalmologists have been some of the hardest hit physicians, especially at the beginning of the pandemic. Tell us a bit about how the function of the ophthalmologist has changed since the pandemic, the onset of the pandemic.
Yes, definitely. Our specialties, any specialty that involves, being close to patients and operating. And when I say operating, I don't mean surgery, but any functioning, working anywhere close to the nose or the mouth. Any area that involves that is going to be affected because we know about the transmission now of coronavirus.
Mm.
Early on in the pandemic, actually one of the first doctors, actually one of the whistleblower doctor in China, was actually an ophthalmologist, and he actually died because of COVID. And he was a glaucoma specialist, and it was thought that he got COVID from a glaucoma patient that he had examined. And that is because early on, we didn't know that much about COVID-19, and we didn't have the PPE and so on and widespread use in the way we do. But it was an early warning signal to us that we need to be extra careful. Anyone who
Right.
has had an eye examination or seen somebody's eyes being examined realizes that your ophthalmologist is face to face with you. You know, we're inches away from your face. It's not possible to check your eye pressure or your nerve without being very close to the person. And certainly on our equipment in the clinics, we are face to face with people. So social distancing is not an option. Um, and it has meant that, and also, if you've been to an ophthalmology clinic, we're always busy because we're dealing with lots of patients with cataract, glaucoma, diabetes, sometimes consequences of hypertension that affect the eye. And we know how common these non-communicable diseases are. We know how common the eye diseases are. So our clinics tend to be very busy. So of course, immediately that goes out the window. We have to minimize crowding, we have to minimize overlap of patients, and we have to minimize our interaction with patients, or that close interaction, not just to protect ourselves from acquiring COVID-19, but to protect the patients from us and from the crowded environment. So you'll find that persons would have experienced that appointments have had to be postponed or clinics have had to be reduced in size. Um, and that definitely has had an impact on how we reach our patients, how we interact with them, and to some extent, I think, their anxiety as well. Because
Right.
the eyes are important. Losing vision is one of the greatest fears. It's well documented that that's one of the greatest fears people have in life. So anything that you think might interfere with your eye check or whatever really tends to lead to a lot of anxiety for people. I try to allay patients' fears a lot with glaucoma because it is a very slow moving disease, and progression tends to happen more so if your eye pressure hasn't been well controlled.
Right.
The majority of glaucoma patients that we see, their eye pressures are fine. I'm sure most of them would think back to, yes, when I went to the eye doctor, they said my pressure was good or they said my pressure was fine. So you can be reassured that if 6 months ago you were on this particular treatment or this particular eye drop and your eye pressure was fine, chances are now your eye pressure is probably still fine once you're doing all those things you're supposed to do and taking that medication regularly and keeping yourself as healthy as possible. Of course, we still want to check people's sight, but we have to balance protecting their lives and protecting their sight. And
Absolutely.
in this balance, life is more important than sight. So for us, we've been making a lot of calls um, and fielding some of those queries, some of those anxieties, allaying them. We have introduced a lot of perhaps all kinds of different systems, high tech and low tech, for reaching patients and making sure they have their medication.
Right.
Calling in prescriptions, sending out medication. You see, the QEH has a medication delivery system as well. That's been a lifeline for the ophthalmology service at the hospital to be able to get our medication out to patients to keep them in stock while keeping them safe as well.
Absolutely.
Telemedicine is a little trickier to do with eye care because there are certain things we can do and certain things we can't do. We can't check your eye pressure over the phone or over the computer, but we can check the vision. We can actually, if we have good cameras on either side, we can actually see the eyeball. We can definitely talk to people about what's been happening, and a lot of our advice comes from once we take a really good history and we can get a general idea of what the eye looks like, we can actually advise people to a great extent on what is happening. And
Right.
it actually helps us to figure out who might actually need to come in then, rather than have everybody come in for things that sometimes we can solve over the phone or by telemedicine. We've had to engage that as well. And I'm not saying that that's been done across the board by all ophthalmologists, but to different extents in different places, depending on what we do.
Right. I wanted to know because I remember last year your theme was this one is for the men
Mm-hmm.
because men generally tend not to seek medical intervention.
Mm-hmm.
It has, how did that go last year in terms of men making a concerted effort to come out and getting their eyes checked. Did you see any increases in terms of the men that presented to the ophthalmologist or even optometrist to get their pressures checked?
I don't know if we can say we saw an increase in those numbers. It always seems to be the women outnumbering the men in the health seeking behavior. But we
Mm-hmm.
really wanted to reach out to our men last year. But what I got was a lot more questions, a lot more calls, and persons following up, not just coming out during the week, but following up with their care and coming in after and being more engaged for sure. That theme was triggered because I had had a few young men
Mm-hmm.
who, 40 or under or around the age of 40, who presented late with very advanced glaucoma.
Wow.
And, you know, these are breadwinners in their families, their fathers driving their children to school. They have their jobs. And, when you think about the real world effect of glaucoma on people, we can talk about all the science and all the fancy stuff, but when you are living with that diagnosis of glaucoma, particularly if it's advanced and you have low vision, it affects everything.
Yeah.
I say to people, think about what it's like for you if you get up in the middle of the night to go to the bathroom or something. You're stumbling around, right? How hard it is to find things, to find the light switch. If you have really advanced glaucoma, it is like that. Everything then becomes a challenge. Even if you're not living in a world of darkness, if you lose your peripheral vision, things like driving become unsafe. So you might have to give up driving.
Yeah.
Depending on the job that you do, your vision might be compromising and it might not be able to do that. We've heard a lot about our national insurance system. If we have people who are losing their vision because of glaucoma and can no longer work, then that's an even greater strain on the system because we have young people who normally would be contributors who now cannot contribute. And this is why I really wanted to reach the men, because our men are so important as pillars of our society. We had a
Mm-hmm.
National Women's Day yesterday, and we know that we women are special, but we really have to remember that our men are important as well. And if we see that disparity where there's fewer of one than the other seeking help in one area, then we have to try to correct that. We have to have the equality both ways.
Absolutely. Absolutely. Dr. Grossner, is there anything that you would like to leave us with for the remainder of this World Glaucoma Week? I know that generally outside of COVID, you would have had an action-packed week with screening and activities, church service, the full works. But is there anything else that you really want to leave with us in terms of a message for us to keep in mind, certainly so that our sight does not end up under pressure, essentially?
Yes, I think that theme, "The world is bright, save your sight," should resonate with all of us, young and old. For younger persons, we've seen that in the pandemic, we've had to pivot, homeschooling, working from home, not working, maybe getting into other areas and exploring other aspects of careers and so on. And we see how important it is for us to be able to ready to move in those directions. And
Right.
if you have good sight, then that is easier. If your
Mm-hmm.
sight is impaired, then it's not quite as easy. So any little thing that you can do to protect your sight uh, is valuable. And this is something very simple. An eye test is a quick and painless thing you can get done. And I really want to encourage people. Yes, we're not doing the screenings this year, but we are trying to get this word out so people know when the opportunity arises. We want them to take advantage of the opportunities to get their eyes checked for glaucoma. It is a big problem in Barbados, but it doesn't have to make people lose their vision. They don't have to go blind. There's so much we can do. There's so much hope. And I know we're right at the end, but there's even hope coming further down the line, because we don't talk about a cure for glaucoma at the moment, because the cure of glaucoma would mean fixing the nerve, growing it back, repairing that damage, and turning back the clock. But very recently, researchers have been able to show that sort of improvement in a mice model, which we think is providing hope for the future potentially.
Right.
So, you want to make sure that you keep your eyes in the best condition so that if you do have glaucoma and a cure is coming down the line, at least your nerve is ready to say, okay, yeah, at least you have a nerve there to help to take that cure, take
Absolutely.
whatever could be coming. And in the
Absolutely.
meantime, for glaucoma patients, don't panic during the pandemic. Just keep doing all the things that you've been doing all along. Engage your eye doctor if necessary, but keep up with your treatment, your eye drops. And when it is safe, you'll get your eyes checked. You get that confirmation you're on the right track.
Great. Thank you so much, Dr. Grossner, for coming out and really increasing the awareness surrounding glaucoma. I mean, you do a very good job every single year, World Glaucoma Week. And I want to really also thank our listeners. Our listeners participated tremendously this evening in the message board. And some of the questions were very important because there are a lot of myths out there as well. So I want to again encourage all of you to follow us and join us on both Podbean and Anchor. And join us next week on First Aid Chats by Dr. G, Closing the Gap. And we will be having Dr. Cheryl Alexis. Good evening, everyone. And thank you so much, Dr. Grossner.
Thank you very much and good night.
Bye-bye.